Pacific, the world's largest epidemic after that in Eastern and Southern Africa, accounting for almost a quarter of annual new HIV acquisition.
A community-based organization in the Philippines. So first of all, thank you for this opportunity. No, and I also want to thank the members of the media who are here today for your efforts to spread awareness on our causes, and of course your critical role as our HIV advocacy partners. No, also I'd like to say that beyond sharing the information, you are shaping the landscape in the HIV discussions. And also your work show how community understand HIV better, challenge stigma, build acceptance, and create an environment where people feel safe to seek care. Now, looking at today's topic, while HIV situation in the Philippines is different from Fiji's situation wherein the Philippines has rising cases of HIV through sexual transmission and has a low transmission when it comes to drug use at 1% or less than 1%. But the challenge is almost the same when it comes to stigma, discrimination, challenges to accessing treatment, support, care, and prevention, and all of these things, as well as those areas where community-led organizations like Love Yourself have an important role to play. So we already know that HIV can be prevented, that treatment works, and that there are various diverse preventive measures that we can stop HIV. But the question is, how can we deliver this to the communities who are needing this the most? Every country may have its different situations and solutions, but one lesson is clear. Communities must be involved in the response. Communities are not just beneficiaries of the HIV programs. We are the indispensable partners towards ending the epidemic. Because as we say in Love Yourself, we know the market because we are the market. So that's where people should look into the government leaders, the global leaders, governments, and all of the stakeholders in HIV landscape must be looking into how they can engage the communities. Now, the opportunity is to scale these evidence-based approaches in ways that fit each country or region's context. So, thankfully, in the Philippines, our newly appointed Secretary of Health are very supportive of this mission. And of course, and that's very important and critical to the Philippine situation as one of the fastest growing HIV epidemics in the world. HIV and drug use in the Philippines should also require us to look into the lens of it as a public health issue rather than a as a public order and security issue, because in the past that's what we are experiencing. And of course, harm reduction saves lives. Evidence shows that interventions such as needle and syringe programs, where appropriate, reduce HIV transmission and connect people to health care. They do not promote drug use. They save lives. Sustained leadership and commitment are needed to implement comprehensive and inclusive HIV prevention and treatment packages. Especially that now in the Philippines, the PhilHealth is only looking into the treatment services, but now we also needed to have prevention packages as well. And that should also include harm reduction in that sense. And hopefully we will be in talks, and these discussions will elevate that talks to our government and to the world leaders who are listening to this symposium. Sexual health education is also important in the Philippines. We have sexual health education, but we are lacking in the implementation of it. So while sexual health education must be evidence-based, it should also be adolescent-friendly and responsive to the diverse realities and needs of the communities. Of course, yes, we follow the science, but we put people first. Because evidence tells us what works, but compassion, dignity, and trust are what help people access and stay adherent to care. So I look forward to sharing our community's experiences in today's session. And obrigado.
Together. So I think that's one of the reasons. But also I think a lot of the issues around the unavailability of sterile needles and syringes is making this situation, like it's just reinforcing this sort of behavior. Like I think once people understand the risk factors associated with the sharing of needles and syringes, that's half the battle. Then it's about convincing, as we all know, people can understand why they shouldn't do things, like why they shouldn't have sex without a condom. But the actual practice of wearing the condom is where the challenge is. And it's the same thing with us. We can have the needle and syringe program. It's about convincing people that the practices they've adopted from kava, from alcohol, should not be used in the situation where you're injecting drugs. So I think that's one of the issues that we're experiencing.
HIV in the Philippines as well.
As mentioned earlier, the drug use prevalence in the Philippines is less than 1%, and it's very localized in the province called Cebu. And there are a couple of interventions before, but it's very fairly unofficial. And now we are looking into how we can merge communications and awareness on how to go for the communities to go to the community centers so that they would be able to access the necessary services that they need. We promote everywhere basically in those areas so that they'll be able to understand what are the risks of taking drugs, injecting drugs, and basically provide information on how to take care and be empowered while having sex. So there.
3 more days. And then I return to my full-time day job, which is the director of the Peter Doherty Institute for Infection and Immunity,